You're listening to Innovators, the podcast from Harris Search Associates, where we speak with global leaders in education, research, engineering, and the health sciences, and ask them to share lessons learned as they continue to advance the frontiers of innovation and discovery. Today's podcast will be led by Rick Skinner, Senior Consultant.
As with much discussion of the COVID-19 virus in America, there's debate over whether the pandemic is near its end or perhaps becoming endemic, and what next steps ought to be considered by organizations, businesses, and institutions. And so the time seems right for university and college boards and executives to take stock of what effects the 2 years of COVID have had to date. This seems especially appropriate for those universities with medical schools and academic medical centers. We sought out a leader among comprehensive institutions with med schools who could speak to the financial and organizational impact of COVID, and we're fortunate to have been able to persuade our guest to share his experience. His resume and the timing of his agreeing to sit with us, making him an ideal voice of experience and perspective. Brian Burnett is Senior Vice President for Finance and Administration at the University of Alabama, Birmingham, a position he assumed in May 2021 from his post as Interim Associate Vice President and Chief Financial Officer of the University of Maryland. He worked in similar posts with the University of Colorado System, the University of Missouri System, and the University of Minnesota. Dr. Burnett was recommended by several persons as a possible guest for Innovators, but it was his 2017 response to an opinion piece in which the writer complained of administrative bloat at the University of Minnesota that caught our eye. Such complaints are frequent. Typically, a spokesperson from the university targeted for criticism makes a polite no response, the institution's leadership having judged a detailed comment would only invite more criticism. In contrast, Dr. Burnett presented a reasoned narrative replete with publicly available data and traced the university's multi-year effects to cut unnecessary costs in order to keep student costs as low as possible. No rancor, more a thoughtful but pointed and very relevant response that sought to set the record straight. Would that we had more of such responses. Welcome, Dr. Burnett, to Innovators. As far as I can tell, there's no one-size-fits-all model for a university and its medical school affiliating with a clinical facility. How they operate and how they come together, I guess, is a kind of a mystery. But would you walk us through the various ways these things come together, how hospitals and clinical facilities and universities come together? And are there different benefits and difficulties attached to any one model? Or does one model have, from your perspective, a particular advantage?
Sure. Well, it's really a symbiotic relationship between the medical school and its clinical partner. And we're very blessed here in Birmingham to have, a very strong health system, the largest in the state, one of the largest hospitals in the United States, that not only provides great care for Alabamians and beyond, but also great training opportunities for our medical students and also our nursing students, health professions, optometry. We've got a number of in public health schools. So it's really a symbiotic relationship between the academic health center and its colleges that we have here in our academic health center. And to say that it makes it unique, most are urban environments, not all. There's some rural environments where you see this kind of arrangement as well. But I would say in this urban environment here in Birmingham, Alabama, it provides a tremendous training ground for a variety of physical issues, conditions, a very diverse population to work with for our students, and some very much cutting edge, both clinical work and research that I think provides a very rich educational background for the healthcare professionals who are training for the next generation. So I would say that it is an absolute mark of quality to have a high quality academic clinical partner to go with an academic health center.
And yours doesn't involve multiple boards, though, does it? You have a single board and a single CEO. Is that correct?
We do. We just evolved that in the last 6 months. So the dean of our medical school is also the CEO of our health system, and the health system has some affiliates with non-university clinical partners in the area to help broaden our reach and to have some partners here. So yes, we have it's not completely unique to higher education in this country, but it is certainly a lot of plates for him to be spinning all at once. And his name is Dr. Selwyn Vickers, and he's the dean of the medical school, but also the CEO of the health system.
Well, that's it. And I do know of a few others like that, and I've been told of the advantages more times than I've heard the disadvantages. A couple of months ago, I think it was back in September of 2021, some of your faculty and at least one other individual co-authored an article in the American Journal of Surgery, and they presented data that showed in the aftermath of COVID, which of course there wasn't, COVID still isn't over, but medical students displayed higher levels of cynicism, lower mental health, and higher rates of burnout in many cases in comparison to pre-COVID student cohorts. I suspect that's not unique to University of Alabama, Birmingham. Would it be safe to say, however, that the infrastructure of medical schools and clinical facilities and their staff were also tremendously affected by the pandemic? But can you give me a sense to what extent has it caused people to leave professions? Has it caused people to more serious dropout problems, stay out problems? What has been the effect on that human and physical infrastructure of dealing with a COVID?
It's a great question. You know, we would submit to you that our most important resource is our people. And certainly the last 2 years plus has stressed them like never before. Both the loneliness, the uncertainty, what happened to our economy, all of that together with also being on the front lines, we treated over 6,000 COVID patients at our academic health center over the past 2 years. Thankfully, today that number is under 10. But we were also one of the big providers of vaccinations for the entire state, and provided vaccinations in all 67 counties in Alabama, working very closely with the state health department as the state's leading academic medical center. But it has been a very big challenge, and I think it is a contributing factor to what's been called the Great Resignation, where those that maybe were late in their career were like, I'm not sure why I want to keep doing this. For others who want to continue working, the request for services from employee assistance to mental health services to the things that come to a typical Office of Human Resources have been quite staggering, candidly. And connecting them in a pandemic world has been a challenge, but we figured it out. I mean, it's amazing what Zoom has done for the ability to hold hybrid meetings and offsite meetings and all those things. So it is an absolute challenge as an employer. We were honored to be chosen by Forbes as one of the best employers in the country.
I was going to commend you for that.
Pride in that. We take great pride in that. But the last 2 years has proven to us that, conspiracy of events like a global pandemic, like inflation, like even now dealing with the outfarts of, war breaking out in Europe, puts a lot of mental strain on folks that already face a great deal of mental challenge in dealing with patients that are subject to trauma or cancerous or in transplant for various reasons. So it's something we're watching carefully, but it has been, I would say, a contributing factor to a portion of the Great Resignation that has affected this university's workforce. And we continue to work on how we're going to overcome that. And some of it may be that for some positions, not all, but some we're going to look at some hybrid work
Mhm.
and maybe even remote work. But
Mhm.
for frontline nurses, frontline doctors, police officers, it doesn't work, right? So how do we support them in a rapidly changing and unstable environment and help them see the value of the services they provide to our students and to our patients, I think is really one of the key leadership challenges coming out of this pandemic for UAB.
Let me follow up on that. I know that you and other hospitals, academic facilities, had to do a lot of modification to facilities in order to accommodate the work that was posed by COVID. You had to do that under duress, in most cases, under very tight time constraints. Putting those back in place, it's got to be a formidable challenge right now, especially with the shortage of skilled craftsmen. How bad is the infrastructure paid? How much of a price is it paid during this COVID period?
You know, it's been a bit of a challenge. I mean, it's amazing how the ingenuity of our folks that do this work for us, they seem to figure it out. You know, going into the pandemic as a university, if you would have said we could have not skipped a beat, at least from a delivering education through Zoom and other forms of technology, so that we could largely not see a reduction in the tuition payments paid to the university over that 2 years, I would have told you that would be I'd be a great scenario. And it actually, for us and most other public universities that I'm aware of in this country, that pivot happened and it worked. And I think that you see similar ingenuity in the clinical trials or in the treatment area that they've used technology. They figured out how it can work and can't work. And then the question going forward is, how do you leverage those investments you've made in that technology
Exactly.
to maybe be a more flexible environment for learning, a more flexible environment for clinical operations, like, video doctor's visits, that type of thing, were something I think we were dipping our toe in the water with. But in the pandemic, it was the primary way we saw a number of patients. And so coming out of it, how do we maintain our flexibility to serve the needs of our patients and our students, while at the same time not abandoning the richness of having that face-to-face interaction? I think that's a go forward piece. But I would compliment the ingenuity of our educators and our clinicians about how they pivoted during the pandemic to react and keep business going to the extent possible they could.
I think it is an extraordinary commendation to all the universities to be able to do that. Let me change subjects a bit for a moment. Some years ago, someone said, well, there's only one growth sector left in American higher education, and that's med schools. Everybody needs a med school. In fact, this past week, Xavier University in Louisiana announced it wants a med school. It's planning a med school, which I believe in Louisiana will be the 5th medical school. First of all, part of that was fueled in the old day, probably 30 years ago, because there was this expectation that after years of holding tight on med school admissions, suddenly there was a recognition, my goodness, we may not have enough physicians. That spurred some of the expansion and growth of med schools. Then the recognition that America is now an aging society, and that there will be more people making claims for access to higher education. That seemed to spurn some changes. And then the in-migration within the United States, the migration of people to states like Alabama and California and Arizona put a lot of population pressure on. You had a system level experience until now from a university perspective. And I suspect that you've seen enough proposals for med schools to have developed a degree of, if not cynicism, perhaps a little bit of skepticism. But having said that, I'm curious how you would respond to a municipality, a state, a university coming to you and saying, Brian, we think we need a new medical school. It primarily needs to develop primary care, maybe a few specializations. What advice would you give them if other than don't do it? What advice would you give them now, given all that you've been through in these last few years?
Well, it's a great question. And what I would say is never underestimate. I saw that article, I saw that story where Dillard was looking at adding a medical school in New Orleans. And it's a worthy goal. I know of other schools that have looked at it, but the costs, the fixed cost to mount an entirely new medical school are substantial. My experience over the last 2 decades working in higher education is that when the costs are a factor, and they almost certainly are, what you've seen cities and states do is look at branch campuses, and Alabama is no exception. So there's only 2 academic medical centers in the state of Alabama, here at UAB and one down at the University of South Alabama in Mobile.
That's it.
But over the last 2 decades, we've expanded clinical training opportunities and the number of students we're training to be medical doctors by the addition of a branch campus in Tuscaloosa that sits on our sister campus in Tuscaloosa. We have one up in Huntsville that sits on the campus of our Huntsville, University of Alabama at Huntsville campus. And then we also have one down in Montgomery at the state capitol. So we have 3 branch medical campuses here at UAB that has widened that pipeline without the expense of setting up an entirely new medical school. With respect to the diversity piece, we have partnerships with Tuskegee, Alabama A&M, and Alabama State, which are HBCUs here in Alabama, to help. And we have one of the more diverse student populations among public medical schools in the South. So my experience, and I've seen that model work in Minnesota with the Duluth campus having a branch medical school. We built one. There's now 2 branch medical schools in Colorado from the University of Colorado, one in Colorado Springs and a new one that's opening in Fort Collins. So my experience is, yes, there are certainly a few new medical schools. The constraining factor are 2 major ones from my perspective. One, the fixed costs to set up and accredit a new medical school are substantial. 2, the clinical rotations needed so that you have the opportunity to get the rounds in and get the training in the clinical setting, is, how in the second or third and fourth year of a medical student's experience is they need that hands-on patient experience. And part of the reason it worked in Colorado and it works here in Alabama is you're tapping into other health systems in other parts of the state and not putting more students on top of the same clinical rotations that are also, medical nursing students are looking for those clinical rotations, physical therapy students, that kind of thing as well. So but for certain on doctors, I think it is about expanding those clinical slots, and the branch campus provides 2 opportunities, both a cheaper alternative and a way to tap into more healthcare facilities to provide that hands-on training.
I just remember mentioning having clinical access. I remember once, as a president of the university, the nurses of the local hospitals would always come and beat me up regularly, claiming that I didn't produce enough nurses. And I used to quickly say to them, but I produce lots of nurses, you just won't let me put many of them on your floors. So it was a bit of a challenge there. So your points are well taken. One last question that's of real importance, but I ask you to sort of look out 10 years when you'll still be in your mid-career. If you looked out 10 years at comprehensive public universities, the ones you've worked at, and you said, what issues will be the top ones that you'll be grappling with then? Knowing full well that the pandemic is probably unprecedented in some way, but if you looked out 10 years, what are the issues in finance and administration that would concern you most 10 years from now?
I just, the continued retrenchment of public investment in higher education, I just think is an issue that's really daunting for our country. You see discussions among congressional Democrats urging President Biden to forgive student loans, across the country and the challenges that presents, because a lot of those student loans are with folks that are doctors and lawyers that have used those loans to create some pretty good income opportunities for themselves. You know, we are grateful for the state support from the state of Alabama, both last year and this year, especially coming out of the recession. The university was not cut in this go round, but we're still adjusted for inflation well below what Alabama was investing in any of our public higher education institutions as of 2008. And that's pretty standard across the entire United States, that big recession in 2008, the big bubble that happened then, it has been about a decade recovery, just nominal dollars to get back to that, not adjusted for inflation. And so as I look ahead 10 years, what I worry about is where's the public support come from? And is higher education going to be seen as a public good, or instead will it be seen increasingly as a private good? And the evidence of that is, you know, where student loan levels, you know, in the trillions are right now. That was not even something we discussed in the 70s or 80s with respect to higher education. And so that's one trend, I think. And I think the second big trend will just be the demographic shift in this country that I think's part of the difficult political discourse we have going right now. Is that we have an increasingly changing demographic, an increasingly diverse country, and how we work together and embrace diversity in all its forms while we continue to learn and grow in the sciences and the responses we've done to this pandemic and other diseases, I think is really the things, as I look out 10 years, what the big challenges folks that will be, you know, moving into leadership roles in higher education will have to deal with.
Let me just follow up on one point. Go ahead,
Yeah,
please. No, let me just follow up on that one point. During, you made allusion several times, and many people have, that during the pandemic, the use of technology soared, just completely took off. Were there any cost savings? And the reason I ask that, because invariably, when this discussion of the disinvestment in higher education comes up, there's always an argument that goes, well, if we would just use technology more effectively, we would be able to reduce the cost. Now, I'm old enough to remember when the first PCs rolled into offices and we all told them we're not going to need to buy paper. And I can even remember saying we're not going to buy paper, and then finding out that we needed more paper. Now, without being real cynical, did the use of technology at the end of the pandemic give us any reason to hold out hope that it might indeed stabilize the cost structure of higher education? Or is that sort of like one of those great myths that is never really going to come true, but we just won't give up on no matter what? Is that going to be part of this picture?
I think it's going to be part of the picture. I think your last part there is right. I don't think technology alone can arrest the cost structure. I think what people also missed during the pandemic, and part of it is that mental health piece we talked about earlier, is the human interaction, that even technology like this, even in this interview right now between you and me, it would be different if you were sitting right here than it is here. I mean, it's good. But when you're in a room full of other student learners trying to grab a complex concept or think about ways we treat a difficult patient's symptoms, that type of thing, it's really hard for technology to replicate the in-person experience and the human interaction. And so I'm dubious about that. I think it's how do we use technology to make ourselves more efficient, and maybe every other meeting is a Zoom / hybrid meeting where we also has a sustainability piece, that we're not driving up and down the roads as much because we can come at it, and maybe we do every other meeting this way. But I continue to think that, you know, folks are not going to want to go to the symphony by watching it on TV. Folks are not going to want to go to the play. And I think the same's true of higher education. There's certainly, for 2-3 decades, there's been pure online colleges that you could attend. But yet, those of us, myself included, we sent our kids to residential experience for
Mhm.
that human interaction piece, that growth that takes place outside the classroom, outside the
Mhm.
instruction. And so I think it could stabilize costs a little bit and keep us flexible for, especially for maybe students that can't travel to our campus.
Mhm.
I think
Mhm.
that's gonna be one of the big winners. But I think, will it take the place or arrest the cost increases? I'm skeptical about that.
Thank you very much for all of your time and all of your thoughts. We really appreciate this. And we're going to be checking back with you in about 10 years when you're only 35 or 38, and we'll find out about your 10-year wish then. Thank you very much, Brian.
All right. Thank you.
Thank you for listening to Innovators, a production of Harris Search Associates. We'll have more insightful conversations with global thought leaders to follow.